And then so flipping over to you then, Dr. Louise, right? Because we have the two corporate leaders here, but you go into corporates and you as train employees and managers. And what are you seeing from that perspective? What does holistic health mean from the perspective of when you go into the company?
Yeah, and I think it matches very nicely with the vitality index of looking at. So I think we have a better appreciation today of what well-being means. Typically, we have only looked at mental health and how people feel. Today, we're also looking at how they relate to other people, so that social well-being. We're also looking at how they function. Can they get through the day? Do they have the energy reserves? Are they able to accomplish the tasks that they're meant to do? And these three actions, if you will, really mirror how we live our lives across a number of different indicators, whether it's in our financial world, our emotional world, our family world, our intellectual world, our environmental world, etc. So what I do in organizations, and what many other people do as well, is really looking at providing people the psychosocial skills to be able to navigate that world. So we might do sessions on meaning, values, and purpose, or optimism and mindset, fixing difficult relationships, building greater relationships. There's a number of different aspects, but also thinking about physical health as well, talking about financial well-being, helping people to manage their resources, their financial resources, make better decisions. So the field has broadened significantly, far beyond simply mental health.
And are you seeing employers wanting to drive that in their organizations?
Yeah, I think, again, there's a greater recognition that people bring their whole selves to work. So it's not just about stress management, but stress related to what? So families, kids, finances, we're talking about everything today at work. I think also the view on employee well-being has also shifted to systemic, looking at, you talked about earlier, how do we build great workplaces so that people can be well and that individuals don't need to do all the work. So there's also a lot more focus on managers today and equipping them with the skills so that they can help their teams nurture their own well-being, grow their own well-being, and the research would support that. So if we look at who holds the greatest influence over employee well-being, it's managers. They drive 70% of employee well-being. That's actually more than employees themselves. So the higher we go up, to leaders, senior leaders, managers, the greater impact we're actually seeing on well-being.
Interesting. Thank you.